नमस्कार, मैं डॉक्टर संतोष कुमार वर्मा, मेंबर टीम फार्मालोग। आज अपने फार्मालोग के मंच पे अपने मेंटर प्रोफेसर डॉक्टर गीर एम इसाक सर का स्वागत करता हूँ। नमस्कार सर।
नमस्कार
सर, वैसे मैं सर किसी परिचय के मोहताज नहीं है, फिर भी हम अपने दर्शकों की जानकारी के लिए बता दें कि गीर सर हमारे एक रेनाउंड एजुकेशनिस्ट है, पॉलिसी मेकर है। वर्तमान में सर यूनिवर्सिटी ऑफ कश्मीर में डायरेक्टर के पद पे कार्यरत हैं, सेंटर फॉर कैरियर प्लानिंग एंड काउंसलिंग सेल के अंदर। जहाँ तक सर के प्रारंभिक शिक्षा की बात है तो सर ने 1995 में बंगलोर के अलामीन विश्वविद्यालय से अपना बी फार्म कंप्लीट किया था। फिर 1997-99 के दौरान सर ने एम फार्म फार्माकोलॉजी राजीव गांधी यूनिवर्सिटी ऑफ हेल्थ साइंसेज से कंप्लीट किया और पीएचडी 2005-2008 के दौरान यूनिवर्सिटी ऑफ कश्मीर से अपना पूरा किया। इससे पहले ही सर ने 1999 के दौरान ही एज ए ड्रग इंस्पेक्टर ड्रग एंड फूड कंट्रोल ऑर्गेनाइजेशन JNK में अपनी सेवा प्रारंभ की। फिर सर का रुझान चूंकि टीचिंग की तरफ था और सर को मौका मिला और अपना सेवा देना शुरू किया जून 2002 से यूनिवर्सिटी ऑफ कश्मीर में एज ए असिस्टेंट प्रोफेसर। और सर का जो अपना कार्यकाल था वो धीरे धीरे आगे बढ़ा, जो 2016 में सर एसोसिएट प्रोफेसर बने और 2019 में सर के पद पे यूनिवर्सिटी ऑफ कश्मीर में कार्यरत हुए। वर्तमान में 2021 से सर डायरेक्टर सेंटर फॉर कैरियर प्लानिंग एंड काउंसलिंग यूनिवर्सिटी ऑफ कश्मीर में कार्यरत हैं। सर को हम बधाई देना चाहेंगे अपने फार्मालोक मंच से कि सर वर्तमान में APTI के JNK प्रांत से प्रेसिडेंट के पद पे निर्वाचित हुए हैं। सर को बहुत बहुत बधाई हमारे टीम फार्मालोक को और हमारे सभी दर्शकों की तरफ से। सर आए दिन ये अपने क्या कहा जाए, अपने बौद्धिकता के तालाब से कुछ न कुछ हम सबके लिए बाहर निकाल के लेके आते हैं। लंबे टाइम से सर का ये न्यू एजुकेशन पॉलिसी पे बड़ा अच्छा योगदान रहा है। अभी हाल फिलहाल इनकी एक आर्टिकल आई है जो ड्रग अब्यूज और उसके पॉलिसी पे आधारित है और जो काफ़ी चर्चा में भी है। तो इसी संदर्भ में हमने सर से रिक्वेस्ट किया कि आज आएँ और अब इस आर्टिकल के बैकग्राउंड में जो इनका थॉट प्रोसेस रहा है उसके बारे में हमारे फार्मालोग को दर्शकों को बताएं, हमारे नौजवान पीढ़ी को बताएं कि ड्रग अब्यूज आखिर है क्या और इसके लिए जो पॉलिसीज हैं या किस तरह से उनको अपने आप को इससे दूर रखना है। तो इस बारे में हम सर से अनुरोध करें कि वो अपने इंसाइट को हमारे दर्शकों के बीच में बताएं, प्लीज।
बहुत बहुत शुक्रिया. Many thanks to you, Dr. Santosh Verma ji. It's a matter of great delight and honor for me to be once again speaking from the platform of Pharmalok. Of course, once again, I would like to mention that Team Pharmalok India has been doing a very commendable job under the leadership of Shri Amit Shah ji and all other respected mentors. And it's a matter of great honor for me that I'm also one of the mentors of Pharmalok. And last year, we had the privilege of having the valedictory session of Pharmalok Yatra on the culmination of the Yatra at Srinagar at our University of Kashmir on the birth anniversary of the father of pharmacy profession in India, Shri late Professor M.L. Sharof sir. And we'll be looking forward to having such functions and events in future again. And we would like to celebrate that event every year and remember the father of pharmacy education in India. And yes, as you rightly mentioned, that I have published a series of articles on drug abuse, on multiple dimensions of drug abuse in the recent past. Many people wanted to know about it and hear from me about what are the various dimensions of drug abuse. So here I am discussing this particular aspect today with our audience, with our members and other students. I hope they will find it useful and they will find it interesting. So we'll be talking today about the multiple dimensions of drug abuse. As you all know that drug abuse is a psychosocial medical problem. It is not just a self-inflicted disorder or a self-inflicted disease, but it is something which is curable, which is treatable. It can be treated, it can be cured, It's not just a self-inflicted disorder. And very recently, on 26th of June, worldwide, we celebrated the International Day Against Drug Abuse and Illicit Trafficking. This year's theme was People First, Stop Stigmatization, Stop Discrimination. The United Nations has laid a lot of emphasis on stopping all kinds of stigmatization of the drug abuse victims. So we need to show empathy towards the victims of drug abuse, but at the same time, we need to be very hard. And Government of India is already, taking stringent measures to curb the menace of drug abuse. And we need to be very strict towards those who are peddling it, who are indulging in the trade of drug substances, illicit drugs, psychotropic substances, because since this is a preventable and treatable disease, these drug abuse victims need our they need our support, our sympathy, our empathy. Not the sympathy, they actually need our empathy, our affection, and our support, so that they can come out of it. So there are effective prevention and treatment interventions which are available, which are very much possible, but the treatment approaches have to be multidisciplinary in nature, because the problem is multidimensional, multifaceted, multi-pronged. The strategies to combat, strategies to counter the abuse, this menace of drug abuse, also have to be multidimensional, multi-pronged, and multifaceted, taking into account all the dimensions of the problem. See, this particular problem has a dimension, a major dimension is that of the social dimension. Then there is a psychological dimension, there is an economic dimension, there is a geopolitical dimension, there is a regulatory and administrative dimension to this problem. Only when we look at it from all the perspectives, through all the prisms, then only we'll be able to evolve a tangible, long-lasting, effective solution to this problem. Because if we work in one single direction, then that will be wastage of our energy, time, resources. That will not yield much results, because if we simply treat it as a medical problem or as a social problem or psychological problem, then it will not work. We have to work comprehensively in an integrated manner and treat all, we need to give equal emphasis, equal attention to all dimensions of this problem. So that is what the whole article series was all about. In the first part, I discussed the social issues, the social dimensions related to this problem. See, first, before discussing about the social or psychological dimensions, here, since most of the audience comprises of the students, first I would like to touch upon the biological dimensions, because this is a problem wherein it overtakes the neurological communication of the brain. When a person becomes addicted to some drugs, some psychotropic substances, his communication network is hijacked by these drugs, and he becomes subservient to it. Then he becomes, completely dependent on and addicted to it, because there is a pathway of reward and the reincarnation, reinforcement working in our limbic system, in our hypothalamus, in our ventral tegmental area, where the neurotransmitters are dopamine and serotonin. Our students know it very well that the neurotransmitter in hypothalamus, basal ganglia, limbic system mostly comprise of the dopamine and serotonin. And our students have studied this in their pharmacology as a chapter, either in third or fourth semester. It comprises a part of the syllabus. So they know that this neurotransmitter is a substance which is released at the synapse, the junction between two neurons. And when this dopamine or serotonin is released as a neurotransmitter at the synapse, which is the synaptic cleft, 80% of it is taken back by the same neuron that releases it. And only 20% binds with the neuroeffector junction, the receptor, and elicits a biological or a pharmacological response. But 80% of it is taken back, reabsorbed by the same neuron which has secreted it, which has released it. And there is a particular process of that reabsorption or reuptake phenomena. But now what happens here, when a person is addicted to substances like heroin or cocaine, they inhibit this neuronal transport system. That is, they do not allow this reuptake to take place. So 100% of dopamine or 100% of serotonin, which has been released into the synaptic cleft, remains in the synaptic cleft. 80% of it is not taken back by the neuron which has released it. And there is continuously, persistently high concentration of serotonin and dopamine at the this neuroeffector junction at the synaptic cleft. So this gives him the high. As we know, the serotonin is a joy hormone, which gives the necessary pleasant feeling, which gives the feeling of pleasure, the feeling of joy. And dopamine is also responsible for mood, behavior, control. Therefore, they continuously remain in a state of high. But when they suddenly stop taking the drug, the dopamine levels abruptly fall down, because the neuronal transport inhibition, which was happening because of heroin or cocaine, is not happening when they stop taking the drug, and reuptake is resumed. 80% of the neurotransmitter is taken back. So the concentration of dopamine at the neuroeffector or junction comes down. And this causes withdrawal syndrome or abstinence syndrome. So this causes a whole lot of psychological and physical symptoms. For example, there is shivering, body ache, discomfort, diarrhea, vomiting, there is palpitation, a whole lot of symptoms start happening, which are known as the withdrawal syndrome or abstinence syndrome. And then there is craving for the drug. The person wants to take immediately more and more of the drug because of these physical and psychological symptoms of withdrawal. And once he takes the drug again the dopamine level builds up in the synaptic cleft. So that is the reward. So now he starts feeling the pleasure once again. And this vicious cycle continues again and again. This vicious cycle of craving, then reward, then deprivation, then discomfort, and again taking the drug. This vicious cycle continues and makes the person slave of the drug. Entrapment happens. It never lets the person go. So it never lets the person get rid of these substances of abuse. Actually, the substance of abuse, substance use disorder is a much better, more technical term to use, because it is earlier the menace of drug abuse used to be restricted to prescription drugs. But now there's a drastic shift from prescription drugs to opioids. And not only opioids, there are several volatile substances also which are being abused. For example, the substances which have the sodium nitrite, which have the butane, which have the acetone, which have toluene, which are volatile liquids which evaporate, which volatilize into gaseous form, and those which are inhaled, those gases are inhaled by these addicts. And therefore, it is not restricted to prescription drugs now. It has more than 90% of abusers nowadays use heroin or cocaine, opioids, and that too injectable opioids. And therefore, and then many use those boot polish or these ink removers or many other substances which have these volatile solvents, acetone or toluene or sodium nitrate or butane, and they become addicted to it. Therefore, substance use disorder is a more relevant and more technical term to be used rather than drug abuse, because it encompasses a whole lot of substances which are being misused nowadays. And again, when we come to the terminology, we need to understand what is the difference between use, abuse, misuse, dependence, and addiction. See, use means normal use, legal, legitimate prescription use of drugs. When a doctor prescribes a drug and a patient uses it, that is use. But suppose a patient does not follow the doctor's advice. Instead of taking a tablet twice, he takes it thrice. Or instead of taking 5 mg, he takes 10 mg. That is misuse of drugs. When he is not following the instructions that given by the doctor, prescription adherence is not there. We call it misuse. But then if he starts continuously taking the drug over the counter and without the prescription, then it becomes abuse. He is starting to abuse the drug. That is, it was meant for something, but he is using for something else. It was meant to calm him down, but he is using for insomnia, or he is using for getting some kind of euphoria, feeling of well-being, getting some kind of high, some kind of excitement. Then it becomes abuse. So that is the second stage. First, it is the drug misuse, then abuse, then it becomes a regular use. Once he starts abusing occasionally, then he starts abusing more frequently. So regular use is the third stage. And after regular use, he starts abusing it more frequently. then it becomes the this he starts getting slowly, gradually, he starts getting addicted to it, and he starts becoming dependent on it. So what do you mean by dependence? Dependence is seen even with those drugs which are not abused. For example, somebody is using a drug for stomach this ulceration or acidity. So when he continues to use the drug for months together, that also makes him dependent, because someday when he doesn't take the drug, he starts getting acidity. So even though it is not a drug of abuse or addictive drug, but still the dependence can be seen over there also. So dependence is used in a context wherein it is used in both prescription and non-prescription drugs. But then when if on stopping that regular use of that particular drug or substance, when he starts getting a withdrawal syndrome, when he starts getting an abstinence syndrome, he starts becoming restless, starts feeling body pain, discomfort, palpitation, irritation, shivering, tremors, vomiting, diarrhea, sleeplessness, then it becomes addiction. Then we call it as addiction. That is, the person is addicted to it physically, psychologically. Addiction is of two types: physical addiction when there are physical symptoms, psychological when there are psychological symptoms like anxiety, stress, depression. And physical means when bodily symptoms, he starts feeling pain in the body or discomfort, muscle aches, things like that. So that is the difference between use, misuse, abuse, dependence, and addiction. I hope I have made myself clear on that point. And once that happens, the person becomes addicted. Now he enters into a very vicious entrapment cycle, which he cannot leave. Even if he wants, he cannot leave unless he receives some kind of medical attention, unless he receives medical intervention. And only upon medical intervention he can be taken back. But as I said in the beginning, it is not something which is not curable. It is a it is a disease. First we need to understand it is a disease, a psychosocial biomedical disease disorder, which can be treated. So we should not stigmatize. As the United Nations has said in the theme, people first, stop stigmatization, stop discrimination. We should not say that, okay, this is a self-inflicted disorder and he should suffer, let him suffer, we cannot do anything. And we should not, on this pretext, isolate the drug abuse victims. We should not dehumanize them. We should not isolate them, or we should not snap our ties or leave them to their fate. We need to give them the proper treatment. That's why I said they need our empathy. Because they, instead of, we immediately, people take them to the police station and get them arrested or things like that. Instead of doing that, we need to take him to a rehabilitation center. We need to take him to a drug de-addiction center, where he will receive medical attention, while he will get the proper treatment, and he'll be able to come out of this menace, and he will be able to break this vicious cycle. So that is what this whole slogan of the United Nations is all about, that we should stop stigmatizing them, isolating them, dehumanizing them, and we should show empathy, and we should help them get reintegrated into the mainstream, get rehabilitated, earn their own livelihood, get rid of these drugs, and live a peaceful, normal life. That is what the attitude and behavior should be. So because there are multiple dimensions, the social dimension is the most important one, because everybody has a role to play in curbing this menace. Whether it is the starting from the home, the parents have a role to play, very important role. The teachers at the school or the college, teachers have an important role to play. The community leaders, the community members have a very important role to play. And NGOs, government, regulatory bodies have a role to play. So everybody is a very important stakeholder in curbing this menace. Starting from the home, the parents need to be very vigilant. They need to be alert, and they need to know they need to very keenly observe the behavior of their children, how they are behaving, how they are spending their days and nights, and how they are doing in their school or their college, who are their friends. Because two important things are there: easy availability and easy accessibility. See, for example, my child is studying in a school. What will make him vulnerable to this menace of drug abuse? If I give him a lot of money, which he doesn't actually need, suppose he needs 50 rupees as the pocket money, but I give him 500 rupees. So obviously he will try to spend it somewhere. Now, on top of it, to make things worse, if there is somebody making drugs available at the school campus or college campus. Then the drugs become accessible to him, they become available to him. Already he has the money in his pocket, and that makes him very, very vulnerable to this menace. So easy availability of drugs at the educational campuses, then easy availability of money and other resources, peer pressure, and being in stress. That if the child is already in stress, these days there is a lot of stress on our children on account of competitive examinations, on account of admissions, on account of faring very well in the examinations, getting top rank. The parents put a lot of pressure on their children, society puts a lot of pressure on the children, that they should score very high percentage, they should get admission in a particular stream or in a particular college, and they should stand first in the class. Everybody wants their children to stand first in the class, whereas fact of the matter is only one person can stand first, and rest of the people have to brood. So this kind of stress and puts them in a tight spot, and sometimes that can make them vulnerable, because emotionally they will be unstable, emotionally they will be not vulnerable to seek some recourse, seek some escape out, and may, if the money and availability is already there, then they may take recourse of drugs of abuse. So that is one aspect that parents have to take care of. They have to frequently check their bags, their rooms, and see if there are any these paraphernalia, like if there are any insulin syringes, any razors, any aluminum foils, any these popping straws. If things like that are there, and if his behavior is odd, he is suddenly stops talking, mixing, socializing, and suddenly he becomes introvert, and suddenly he doesn't show interest in studies, or he doesn't talk much. The parents have to very keenly observe this kind of behavior in their children, and then they have to take adequate measures and see where the problem lies. Similarly, teachers are very important in this whole process, because teachers are the adults which are mixed up with students very frequently, know their emotions, their emotional status, their feelings, their insights and outlooks, and they can identify some kind of odd behavior, some kind of abrupt changes in the behavior of the students, and then they can see where the problem lies. They can counsel the students, and they can give them the proper guidance, and they can see what kind of emotional stress the students are going through, and they can also be alert and maintain vigil in the campuses, that the availability is not there, availability of substances of abuse is not there in the vicinity of the campuses. So teachers then can sit with the parents and discuss this situation, and they can discuss the problems of the children and see some tangible, credible way out of that. And then thirdly, the community leaders, a very important role they have to play. They have to identify the drug abuse victims in their communities, in their mohallas, and then they have to counsel them. They have to see whether they need any kind of financial assistance, any kind of psychological counseling, any kind of educational assistance, and that needs to be given to such children who are deprived, who are underprivileged, who are under stress, or who are having tendencies to move towards drug abuse. So community leaders, community groups, welfare, these associations have a very important role to play as far as the social. These are the social dimensions. And then if we look at the psychological dimensions of the problem, there are several stages which come in the life of a child, and at every stage he takes a new turn, he achieves a new milestone. And for example, at the school level, the student starts to develop at high school level. He starts to develop his own insights, likes, dislikes, opinions, and he starts throwing tantrums, and he starts wants to take his own decisions. So this is a very crucial phase in the life of a child, when he is in the teenage and stepping into the high school level. So we need to give him the freedom, the liberty, and address his emotional constraints, address his emotional outbursts, and address his concerns, and what are his key areas where his this mental attention is going towards. So at that point of time, psychological counseling becomes very important. We have to guide him in choosing a right career, because often the stress of career is very important. If doing well in the classes, achieving high grades, and getting admissions for higher studies, these are the sources of stress for children. Same is the case in college level. When the child reaches the college level, at college level he finds new atmosphere, new kind of ambience, new friends, new social circles, new groups, And this sometimes it makes certain students very, very emotionally unstable, and they cannot cope up with the brisk changes happening in their life, the new atmosphere, new ambience. They're not able to adapt themselves to these new atmospheres, new ambiences. And this is where psychological counseling could prove to be very handy. So there is need for psychological counselors who are trained, qualified, and experienced. They need to guide such students not only in their career but also in their personal life. What are their emotional stresses, concerns? And then they need to be in constant touch with the parents and discuss these things out. So there has to be, as per guidelines of NCRT, UGC, the psychological counselors have to be made available at the school premises, college premises, university campuses, so that students can frequently go and seek psychological. There are two types of counselors actually that are needed in all educational campuses. One is the career counselor, another one is the psychological counselor. Psychological counselor has to be a trained clinical psychologist or a psychiatrist, while as career counselor has to be a trained career this guidance expert. And they need some, because career guidance is very, very important. We need to understand where their personality is, what kind of inclinations they have, where their interest lies, which career will suit them the best. So parents should stop thrusting careers on their children which they are not interested in, and they should rather see where his personality lies, what are his traits, where his interests and inclinations are, and accordingly they should help them choose such type of a career where they have the passion to excel, and wherein they will emerge victorious and successful in their life ahead. So psychological factors become equally important: the presence, availability of a psychological counselor, and then the coping strategies. For example, the many students worldwide are suffering from depression, bipolar disorder, stress, anxiety, exam related, admission related, career related, job related. That anxiety has to be relieved by psychotherapies, by counseling therapies. So psychotherapy means talk therapy. We need to help them cope up the day-to-day stress, and we need to help them break the vicious cycle of these thoughts, feelings, and behavior. And continuous negative thoughts lead to negative behavior, and negative behavior, first there are feelings, then there are negative thoughts, then negative behavior, and this vicious cycle continues. Negative feelings lead to negative thoughts, negative behavior, and that leads to sometimes antisocial behavior also, lands people in trouble. And only a psychological counselor or a psychotherapist can help them come out of this vicious cycle. So that is about the psychological dimension. I'm talking very briefly. I have written in more detail in my articles, which you can refer to always. But here I am, because of the constraints of the time, I am speaking very briefly about each dimension. So third dimension is the biological and medical dimension. Biological, as I said, there is these drugs of abuse or substances of abuse. They hijack the brain communication system and make him subservient to taking more and more drugs, because of this vicious cycle of reward and this reinforcement, and the more and more craving for the drug, because of the non availability of dopamine when a person stops taking the drug. So dopamine is a very important hormone which has a role to play over there. And there are many other ways, genuine legitimate ways, by which we can increase the dopamine level, which we can increase the serotonin level in our body, which are joy hormones, which give us the excitement, the feeling of pleasure. For example, if we spend time in, if we undertake physical exercise, we spend time in sunlight, if we take adequate rest, and if we take good amount of proteins which are available in these poultry products, or those who take non-vegetarian in chicken and fish and eggs, and the other dairy products, honey is there, straw, these several fruits and vegetables are very rich in such substances which increase the this serotonin level. So serotonin is something which cannot be synthesized on its own. So we need tryptophan, amino acid tryptophan is needed for synthesis of serotonin, but tryptophan has to be taken through food. And there are many, which I mentioned, the dairy products and other vegetables, and honey is there, strawberry is there, and pineapple is there. These seeds are there, nuts are there, which are very rich in tryptophan. So if we consume more and more of those foods, the serotonin levels will go up in our body, and that will give us some kind of relief, some kind of pleasant feeling, will positively impact upon our mood and behavior. This is what we need to understand. There are legitimate, genuine ways of getting a good feeling, good mood, and good behavior. other than taking recourse to these substances of abuse, because these substances of abuse provide momentary pleasure, and this is not long lasting. This pleasure is deceptive. So just for momentary pleasure of a few seconds, we should not make ourselves slaves of these substances of abuse, because, and we should not ruin our career, our life, our social life, our education, and our this future life. We should not ruin everything just for a few moments of deceptive pleasure. This pleasure is not long lasting, it is not genuine, it is deceptive, my dear friends. And so far as the medical dimensions of the problem are concerned, in medical dimensions, we need to understand the types of drug abuse. We need to understand the pharmacoepidemiology. We need to understand the mortality and morbidity due to drug abuse. We need to understand its signs and symptoms. We need to understand what are the various treatments available and how we can prevent it. Prevention and control is very, very important. Treatment and rehabilitation is also equally important. So we need to understand what are the, first of all, what are the various types and what are its signs and symptoms. For example, as I mentioned, some of the signs and symptoms, and then what are the effects. We need to understand the etiology of drug abuse, that is the causes. What are the various causative factors, and the pathogenesis of drug abuse, that is the mechanism, how it affects our body. See, when a person starts taking drugs regularly, abusing drug substances regularly, his kidneys get damaged, his liver gets damaged, his lungs gets damaged, his immune system gets damaged, his dermatological skin gets damaged because of injections, his cardiovascular functioning gets impaired, and his overall body structure, his aesthetics, everything gets affected. So in the long run, they have devastating effects on our body, on our health. That is, they can cause kidney failure, they can cause respiratory failure, they can cause lung disease, because when those who inhale the drugs, the lungs get affected very frequently. They can, those who inject the drugs, they can have dermatological problems, they can have these blockages in their veins and arteries, sometimes leading to even death of the person. And their immune system becomes very, very weak, they become vulnerable to many other diseases. And this cardiovascular system, they get palpitations, they get arrhythmias, and sometimes even cardiac arrest can happen. Many people nowadays, young people die, and many a times it has been found that they die because of cardiac arrest due to overdose of heroin or cocaine or any other opioid substance. And then we need to understand what are the various substances of abuse. See, the substances of abuse includes opioids, prescription drugs, volatile substances. For example, among opioids, we have the morphine, codeine, hydromorphone, hydrocodone, hydroindolone, and we have buprenorphine, and many other these products, fentanyl. Some of them are natural, some are semi-synthetic, some are purely synthetic. For example, fentanyl is synthetic, hydromorphone, hydrocodone is semi-synthetic, but morphine and codeine are natural. So some have a natural source, some have a synthetic source, some have a semi-synthetic source. And then prescription drugs like spasmoproximon and these codeine containing syrups and all. And then we have amphetamine, dextroamphetamine, methamphetamine, methylphenidate. Many substances are there which are substances of abuse. And among the volatile these substances, those which have sodium nitrite, which have butane, which have acetone, petrol, for example, things like petrol, nail polish, boot polish, ink removers, stain removers are used. And then we need to understand what are the signs and symptoms. The person becomes isolated, introvert, he starts getting tremors, and he sometimes vomiting and diarrhea is seen, sweating, excess of sweating, excess of thirst, body discomfort is seen. And then those people start behaving very erroneously, their behavior is very erratic, and they start getting sometimes very aggressive and sometimes very isolated and depressed. So these signs and symptoms we need to understand, teachers need to understand, parents need to understand, and they need to identify the people who are getting towards drugs, so that at a particular stage, at the right time, they can be stopped from getting into this dragnet and they can be brought back. So these are the medical issues which need to be considered. And then how many people die, how many people suffer from other morbidities, other diseases, how many people. So overall, millions of people die worldwide. around 300 million people, are taking drugs worldwide, more than that actually. In our own J&K state, where in northern parts of India, in states like Punjab, Haryana, Rajasthan, Jammu and Kashmir, which is bordering the golden, this golden crescent and golden triangle. That is the geographical dimension of this problem. That India is sandwiched between golden crescent and golden triangle. Golden crescent comprises of countries like Afghanistan, Iran, and Pakistan, which have been since ages been the opium cultivators. And on the other side, the eastern side, we have the golden triangle. Again, three countries: Vietnam, Myanmar, and Thailand, which again have been the cultivators of opium since ages. So India was traditionally a transit route for these drugs of abuse, but unfortunately, now it has turned into a destination also. Though the government of India is taking very stringent measures to curb it, showing zero tolerance to peddlers and drug traffickers, and awarding severe punishment to those found involved in the trade. And only a few days back, Honorable Home Minister Shri Amit Shah ji declared in one of the conferences in Delhi that drugs worth more than 10 lakh kgs have been destroyed, and they were worth more than 12,000 crores have been destroyed by the Narcotics Control Bureau of India and by the Anti-Narcotics Task Force. So the government of India is taking stringent measures to curb this menace, but we need to take many more measures and more steps to curb it. And that is what brings us to the administrative and regulatory dimensions of this problem. So when we look at the administrative and regulatory dimensions, there are a whole lot of steps that need to be taken by the administration, by the government, by the regulatory bodies. First and foremost, we need to create credible evidence, scientific evidence. What is the actual number of drug abusers, and how they are getting it, where they are using it, how much money they are spending on it, and where from they get the money. So that we need to interview these victims of drug abuse in large numbers, and we need to generate credible evidence, scientific evidence, which can be used to develop our strategies to counter this menace, to curb this menace. Therefore, first step is generating credible scientific evidence about the actual problem, about the dimensions of the problem, the incidence, the prevalence, what is the scale of this problem, the quantum of usage, and how much money is going into it. So once we generate that credible evidence, that is the first step, through scientific studies, well established, well organized, systematic scientific studies. Then we need to transform that evidence into a concrete, robust policy framework. So that evidence has to be converted into a robust policy framework, taking all adequate strategies which I mentioned to curb the menace. And then the policy has to be translated into action. Unless policies are translated into action, they will be worth the piece of paper on which they are written. The action has to be taken on the ground. Unfortunately, many a times it so happens that policies remain confounded. They remain confined to the almirahs and cabinets, but very little action is taken on the ground. But Government of India and Government of J&K are very much serious in taking action, and they are taking concrete action. So the evidence has to get converted into policy, robust, comprehensive policy, strategic policy, and policy has to get translated into action on the ground. And once that happens, so what action will be taken? Action has to be three-pronged. There has to be three strategies for taking action. One is supply reduction, second is demand reduction, and third is harm reduction. So supply reduction strategies means the supply chain has to be broken. The manufacture, production, sale, storage, and distribution of drugs of abuse has to be controlled. Their entry into our country, their distribution, sale, their movement within our country, their manufacture, and their these supply channels, the trafficking, peddling of these substances has to be controlled. So here we need to see where from they are coming, how they are distributed, where they are, what are the channels which are working behind it, and we need to the government needs to take control. So all the concerned departments, whether it's the police department, the excise department, the drug de-addiction department, drug control department, the education department, sports department, they have to join hands and work in a very collaborative and integrated manner to control this menace of supply chain and control this distribution and sale of substances of abuse. So that is the one aspect, the supply reduction strategy. Second aspect is the demand reduction strategy. Demand reduction means the craving for the drug, demand for the drug, the need for the drug has to be reduced by creating more and more awareness, by creating education like the one which we are doing today. We are creating awareness, we are educating the people, informing the people about ill effects, about how they affects their life, their personal life, physical life, sexual life, and even economy, how it affects their economy, and financially they get crippled. Because every year it is believed that one drug addict spends around 1 million rupees for every month. It is a rough estimate. So it is a multi-million industry now. So it has economic aspects also. So demand reduction is very, very important. Regular awareness measures, awareness programs need to be created. People need to be educated. What are the harmful effects, ill effects, and what are the repercussions, how they will be punished by law. There are very stringent legal provisions in this Drugs and Psychotropic Substances Act of 1985. Even mere possession of few grams will land you up in a jail, and the punishments goes up to several years, more than 10 years. So therefore people need to be made aware of this. That will cover the second aspect, the demand aspect. And third important aspect is the harm reduction strategies. Harm reduction means treatment, rehabilitation, reintegration, giving the drug abuse victims a chance to earn their livelihood, giving them vocational training, and giving them proper treatment, making the drug de-addiction treatment available, accessible, equitable. It has to be made universal. Everybody should have access. It has to be made affordable. It should be affordable. And then once it is made affordable, accessible to all, and then we need to take strategies to give them the opportunity to generate their livelihood, to earn their livelihood, and reintegrate back into the mainstream, come back to their community, and live a normal, peaceful life without any stigmatization, without any kind of harassment or humiliation. So that is what harm strategies are all about. We need to establish more and more rehabilitation centers, more and more community-led peer group centers, and we need to have, Government of India has already taken several measures to establish anti-drug outlets, anti-drug these facilities, and in every state. Then in every district they have these drug control, drug de-addiction treatment facilities, they have the rehabilitation facilities, and they have established community-led peer interventions groups. And so these things need to be made more and more available, and then their number has to be increased throughout the country. The government has to establish more and more drug de-addiction and rehabilitation centers, so that whenever there is a drug abuse victim, he gets proper treatment and he gets rehabilitated quickly. So there has to be Directorate of Drug De-addiction and Rehabilitation. We need to take, there are two aspects: prevention, control, treatment, and rehabilitation. Everything has to be taken simultaneously. So all the three strategies, supply reduction, demand reduction, and harm reduction strategies, have to be taken simultaneously. Then only it will work. All the dimensions have to be addressed simultaneously. All the stakeholders have to join hands and work together in unison, and then only there will be some fruitful effects which will be seen on the ground. There will be some productive results which will be seen on the ground. And the government has to make the laws very stringent, establish these special courts to deal with such cases. The peddlers should be awarded stringent punishments, the traffickers should be awarded stringent punishments. But we need to show empathy with the victims. We need to give them proper treatment and rehabilitation facilities in every district, in every state. And looking at the number of drug abusers, only yesterday I was reading in a national newspaper that in one of the drug addiction centers here in Srinagar, they receive a patient every 12 minutes. Every 12 minutes there is a new patient. So earlier we used to believe that drug abuse is the problem of the lower strata of the society. It is a problem of the uneducated people, and it is a problem of a particular section of the society. But this does not hold good anymore. Nowadays, people from all sections of the society, whether they are rich or poor, whether they belong to urban or rural community, whether they are educated or not educated, they have fallen prey to this menace. So this has engulfed all sections of the society, all strata of the society, whether they are rich or poor, whether they are going to school or not going to school, whether they are male or females, young or old. Even young as well as elderly people are falling prey. So there are no such distinctions and discriminations in the menace of drug abuse nowadays. It is affecting every section, every segment of the society equally. Therefore, we need to have proper strategies, proper facilities available in our centers, wherein adequate treatment and rehabilitation could be awarded, could be afforded to these victims of substance abuse, victims of drug abuse. And we need to take measures to generate credible evidence through research, convert that into policy framework, and practice that policy on the ground, and take everybody on board, have a directorate, and every department has to collaborate, coordinate, integrate, and communicate with other departments who are very much relevant in curbing this menace. And we need to understand very well, our students need to understand what is its pathology, pathophysiology, etiology, what are its medical signs and symptoms, treatment strategies. Well, I have not discussed those things here because my intention was to talk about the article series which I have published. But we need to have more regular sessions in which we can talk about the actual problem, its health effects, its treatment strategies, types of drug substances of abuse. I have not classified them because I have not used any PowerPoint presentation, but we can make a PowerPoint presentation wherein we can classify them, tell them what are the various substances and what are their ill effects and how to treat them, what are the various drugs which are used to treat these drug abuse, drug addiction patients. So that's it. I think for today, my time is up. And if we get time in some other day or some other time, we can talk about those issues in more detail, which will benefit the students. So I hope I have been able to make my point clear in this particular program. Many thanks to PharmaLog team for giving me this opportunity. And many thanks to Dr. Santosh Verma ji for keenly listening to me. Thank you very much, sir.
Thank you, sir. Thank you so much. On behalf of our audience on the YouTube channel of PharmaLog, I extend my heartfelt thanks to you for enlightening us with an incredibly insightful and thought-provoking talk on the critical topic of drug abuse. This enlightening session was made possible through PharmaLog YouTube channel, specific edition, PharmaLog Ki Paathsala, which continue to provide us this valuable knowledge and awareness. Sir, your expertise and dedication were genuinely evident as you divide into the multi-faced issue of the drug abuse. Your comprehensive insight on this topic not only highlights the learning alarming strategies, but also provided and preventing measures associated with drug abuse. Your ability to communicate complex ideas in a relatable manner undoubtedly left a long-lasting effect on all of us. We are immensely grateful to PharmaLog for facilitating this platform that brings expert talk like Dr. Geer to our stream, allow us to broaden our horizon and gain valuable insight. This talk serves as a testament to the channel's commitment and promoting knowledge dimensions and fostering awareness about crucial social issues. Thank you, Dr. Geer, for your enlightening insight, and thank you to PharmaLog for providing this platform. Together, we can make a difference. Thank you, all our
Thank you.
audience, and sir, again.
Thank you very much for that elaborate description. Many thanks to you.